After surgery, you'll be coming to a room similar to this one. You'll have EKG monitors, which will be looking at your heart rate, oxygen levels, blood pressure. You're going to have IV pain medicine in addition to your on-Q catheters for the first night. The very next morning, your chest tube comes out, we switch you to pain pills, and you get up and you start walking. Provided everything's going well, you're expected to go home the very next day, and most patients are up, doing well, and ready to go home.
Good afternoon. My name's Marianne Merritt. I work with Dr. Jaroszewski in cardiothoracic surgery and to take good care of you following your Pectus surgery. We'll have you come back to our clinic following your discharge from the hospital, and we'll see you with a chest x-ray as well as get your dressings down and remove sutures. And this is our on-Q Painball, and while it may look a little intimidating, it's very straightforward. This is a reservoir of a long-acting local anesthetic that is delivered at a continuous rate of speed, 7 milliliters an hour, through these tiny catheters, one for each side of your chest, with multiple hose, like a soaker hose of sorts, delivering this long-acting local anesthetic continuously to these tissues. You can go home from the hospital with this, it's no problem. You can remove it yourself, or you can come into clinic and we can remove it. Either way, it's quick, easy, and painless. So you'll have these two incisions. You can see them nicely here on the side, even though they're almost invisible. These are inevitably early in your postoperative course a little more swollen, tender. Some of these patients don't even feel it, though they may feel numbness here and some sense of altered sensation. We expect that at this early time in the recovery. These sutures here are absorbable. They do not need to be removed. There is a small stitch here where Dr. Jaroszewski had our camera initially and then secured the chest tube. I will remove that stitch with a small delicate scissor and give these to you to take home if you'd like them for a souvenir, and then we'll just put a small band-aid on that. It's fine for you to shower. Soap and water is no problem. We don't want you swimming in a pool or soaking in a tub for several weeks. No pool is as clean as you think it is, and infection in this setting would be catastrophic with hardware. So we want to make sure that these incisions are healed nicely before you're soaking in a tub or swimming in a pool. But like I said, soap and water is perfectly fine in the shower. So in regard to your scars, after these incisions have healed nicely and there's no more scabbing, we want you to protect these incisions from the sun for a year, round figures, with some good sunblock. We usually say SPF of 30 or higher on these incisions, and that's good advice whether you've had surgery on your forehead, your baby toe, or your chest. You want to cover those incisions and protect them from the sun for a year. Naturally, they will darken initially, but will lighten over time. Here you are, discharged from the hospital, back in clinic. We've gotten your sutures out. We are discussing your anticipated post-operative course, and in that we will send you home with prescriptions for medications for 4 weeks. You may not need pain medicine for the full 4 weeks, but we do ask our patients, even if they're not taking any other pain medicine, to continue on the gabapentin, which is a nice nerve membrane stabilizing medication that helps with the pain management and the altered sensation. Paresthesia is the technical term for that so many of our patients experience after Pectus surgery. Following your discharge from the hospital, we will provide you with a travel card for the purposes of air travel if you would get hung up by TSA that you do have metal hardware in your chest that theoretically should set off their detection devices, and you'll have this card to supply as evidence of your surgical repair. There's a couple other items on here that are of equal importance. One, if you need an MRI for any reason in the future, that this hardware is compatible with that. As well, if you needed CPR, that you could undergo CPR, as well as if you needed, for whatever reason, defibrillation. Following discharge from the hospital, we will check another chest x-ray at your first post-op visit. If that looks good, we will clear you to travel if you're going far away or just across the street. We will want to see another chest x-ray at around the 6-month mark. All of these times of surveillance will be from the time of surgery. So if you lived in New York, you would send us an x-ray on a disc. We will load it into our electronic software for Dr. Jaroszewski to review your films side by side for stability of the hardware. Once those have been reviewed at the 6-week mark, if you're doing well and the x-rays are stable, we will release you to full activity. We will continue to follow you. We'll want to see another x-ray at 6 months, again from the time of surgery, and then another 6 months, and now we're at a year from surgery. Following that landmark, we'll let you stretch out to annual monitoring until we reach the 3rd year mark, is when we're looking at the right time for you to come back to return to Phoenix for bar removal. We want to hear from you. If you have extreme pain that is out of the ordinary of what you had been experiencing previously, if you have an elevated temperature higher than 105, we want to know about that. It is normal to have some variations in temperature and even a low-grade fever of 99 or 100 as your body is healing from surgery and your recovery. Additionally, if your wound has a change, it becomes increasingly red, you start seeing some drainage, pus, any concerns of that nature, we want to hear from you right away. I'm going to bring Dr. Jaroszewski back in, and she's going to review some good stretches to assist in your recovery further.
After surgery, stretching and movement is critical. Even immediately, the very first day after your procedure, I want you gently stretching. You need to be lifting your arms very slowly and easily. We try to keep a pillow or a blanket behind your back so that as you're sitting, you're constantly moving back, with the idea of rounding out, stretching your chest forward. Within a week, you can do more progressive stretching. You can put your arms up against the wall. You can be stretching back and around, pulling your pectoralis here, bringing your arms all the way up over your head, stretching back and down posteriorly and all the way back. About 4 to 6 weeks, you could start doing more aggressive, heavy exercise. Before that, you can do lower, you can do abdominal, but I don't want you over-stressing your chest muscles. You can start doing light hand weights, you can start doing more movements, you can do more significant stretching and movement. You can get a large exercise inflatable ball, which you can actually lay against, and you can actually lay against the ball and stretch backwards with putting your arms out. And the more you can stretch and open up this front, the better.
We're looking forward to taking care of you after your pectus repair, whether you live in Phoenix or the South Island of New Jersey. We'll follow you closely. Your calls will get a high priority, and we'll follow your films for 3 years or as long as your hardware is in place.